So our next speaker is Dr. Keum Jee Chung
Yes, that's me.
from she's a team leader of the Korea Electronics and Technology Institution, KETI. Let's welcome her.
Good afternoon, everyone. I'm pleased to introduce Korea Electronics Technology Institute to you. I'm working at the Global Cooperation Team of the External Relations Department. So KETI plays a vital role in solving industrial challenges and supporting technological development for small and medium-sized enterprises. We also contribute to addressing national and societal issues by developing solutions in 7 strategic technology areas you can see at the bottom, which are AI, semiconductor, robotics and mobility, energy, safety, security, quantum, and space and defense. Through these efforts, we help strengthen Korea's industrial ecosystem and enhance national competitiveness. Let me go through briefly about KETI's history. KETI was founded in 1991, originally as the Korea Electronics Technology Laboratory then, and in 1999, it became an independent legal entity. And in 2005, we located our headquarters from Pyeongtaek to Bundang. Bundang is very close to Seoul. And over the years, KETI has been recognized as a leading R&D institute, driving innovation in the electrical industry. And in 2012, KETI was named among Thomson Reuters' top 100 global tech leaders. And 2020, we received the Presidential Commendation for SME Innovation. In recent years, we've continued to grow, and opening the Smart Manufacturing Innovation Center in Changwon in 2021, surpassing an annual budget of 300 billion Korean won, which is about $204 million in 2023, and opening the System Semiconductor Verification Support Center in Pangyo, which is also close to Seoul, in last year. As of today, KETI operates with a budget of approximately $270 million and about 1,400 employees. Our organization includes 2 R&D laboratories, and under these 2 laboratories, there are 6 research divisions, 3 regional branches, and 3 administrative divisions. And we also have a medical IT convergence department and also the smart sensor department, which they gave their introductions to me to show to you later on. Because electronics has been around everywhere for quite a while, our research areas are wide and still expanding. We are not limited to the Seoul metropolitan area. We have established regional branches across the country to support localized industrial innovation. As I mentioned earlier, our headquarters is located in Yatab, Seongnam, very close to Seoul, with research hubs in Pangyo, Sangam, and also in Bucheon. These are all near Seoul in the metropolitan area. But additionally, we operate regional centers in Jeonbuk, Jeonnam, and South Region, and also Cheongju, Ochang, promoting regional R&D collaboration and specialized industrial development. So let's go more closely to these industrial sites. Each regional center focuses on specific strategic industries. This one is the most recent one that was built, which is located in Ochang, and KETI runs Korea's largest secondary battery research and support facility dedicated to materials and component testing. The Changwon Smart Manufacturing Innovation Center supports precision machinery, defense, and aerospace industries through AI and data-driven smart manufacturing platforms. And in Seoul Susa area, we have the Robot Plus test field serving as a testing ground for robotics and collaborative intelligence, supporting the development of next generation robot technologies. Moving on to global cooperation. KETI's R&D activities extend far beyond Korea and through strong international collaboration networks. We work very closely with the Korean government and with international governments, industries, and academic institutions around the world to develop joint research projects, technology transfers, and co-funded innovation programs. KETI also supports Korean companies by participating in global exhibitions such as the CES, connecting them with market opportunities and potential partners worldwide. Since the establishment, we have built partnerships with about 186 institutions across 52 countries. We maintain particularly strong collaborations with partners in the United States and also in Germany. In the United States, we are working with universities. Those are designated as GITCC centers, and also Stanford too. And in areas like robotics, mobility, semiconductor, and next generation batteries. In Germany, we are working with TÜV Süd, Fraunhofer Institutes, and Scheffler Group on AI-based manufacturing, mobile robotics, and certification services for smart mobility. Our global network also includes leading institutions in France, the Czech Republic, Poland, and the UK, Austria, Vietnam, and many other expanding cooperations in AI, digital twins, semiconductors, and future mobility. We have 8 ongoing GITCC R&D projects, and 4 are projects with US partners, and the other 4 are with non-US partners. And these research areas are various, such as semiconductor, battery, AI, and robotics. We don't have one with the Johns Hopkins yet, but we are very eager to develop one. And these are some of the non-GITCC projects, the international collaboration projects. In the US, we collaborate with Solid Power in solid-state batteries and with the University of Florida on integrated semiconductors. Our work with the German Fraunhofer Institutes focuses on advanced semiconductor technologies. And we are also working with the University of New South Wales in Australia in the energy area, and also with Japan, France, and Australia. So from now on, our centers gave me to present some ideas with you. The first one comes from the Smart Sensor Research Center. I think the Smart Sensor Research Center is getting ready to actually propose an item for next year's GITCC R&D project. So I think I bring the introduction to one of the topics that our researchers are currently conducting. And this is the K-Sensor technology, a surface acoustic wave sensor platform for an on-site detection of drugs and human DNA at crime scenes. Our goal is to deliver rapid, portable, and field-ready sensing that supports frontline forensic work. Left side is the principle of this. The SAW sensor, the surface acoustic wave sensor, converts changes at the surface of a piezoelectric substrate into measurable frequency shifts as an acoustic wave travels along the surface. And this principle makes the device applicable to the detection of very small masses, including drugs, DNA, viruses, and hazardous chemicals. And in practice, we implemented 2 forensic use cases: unknown drug identification and also the human DNA screening. So for the unknown drug identification, collected on site, the suspected liquid drug is mixed with a multiplex antibody solution and introduced into a sensor array coated with various drug BSA conjugates. And depending on whether the drug is present, the array yields different frequency responses, enabling the identification of the unknown liquid drug. And for the human DNA detection, is to screen the presence of human genomic DNA. We capture the DNA from fingerprints, epithelial cells, and bloodily fluids. On a negatively charged silicon dioxide surface, DNA binding, often mediated by cations such as sodium ions and calcium ions, increases the effectiveness mass. And our system for drug and DNA is portable. weighing less than 250 grams, and it delivers results in 2 minutes. The next topic comes from the Medical IT Convergence Research Center. These are the areas which our center is focusing on. It's mainly the public healthcare, particularly addressing the medical disparities among regions and societal groups. In Korea, access to emergency medical service within 1 hour still differs greatly between metropolitan and non-metropolitan areas. So people in rural or remote regions often face longer travel distances, higher transportation costs, and greater financial burdens. So these gaps result in significant social and economic costs, both for patients and their families. So KETI aims to reduce these disparities through digital convergence in medical device technology. And by integrating AI-based medical agents into healthcare systems, we can help equalize access to quality medical services, ensuring that location or income or education level no longer determines the level of care of a person receives. The second focus area is medical mobility, centered on what we call the flexible healthcare bus. This concept provides high-quality medical service anytime, anywhere by bringing the clinic directly to the community. And each bus is equipped with miniaturized high-tech medical devices capable of performing real-time diagnostics and health consultations. It supports multiple medical devices through an unified communication interface, creating a flexible infrastructure for mobile healthcare delivery. So this slide introduces our first research case, the flexible healthcare bus. In this program, Seoul focuses on developing major medical diagnosis system and AI-based medical software, while Busan focuses on the configuration and on-site operation of the healthcare buses. Busan became the first city in Korea designated as a super-aged society with more than 20% of its population aged 65 or older as of 2021. And to respond to this demographic change, the Busan metropolitan city plans to gradually expand the number of medical buses so that high-quality health services can reach more neighborhoods and elderly residents. Each flexible healthcare bus works as an essentially bringing hospital-level services directly to the community. And KETI aims to demonstrate how AI and medical device convergence can strengthen local healthcare infrastructure and provide a scalable model for smart mobile healthcare services nationwide. So the next slides are what we're proposing. Because we are focusing on the AI-driven physical technologies that can assist human across various medical environments. So on the left is the KETI's work on flexible medical data and infrastructure. Our goal is to provide up-to-date health condition information by integrating diverse medical devices from external diagnostic systems to telemedicine platforms. Through AI-based vital sign analysis, these systems help detect and prevent healthcare vulnerabilities before disease severity increases. On the right side, you are looking at our AI-based data and physical modules that support healthcare professionals. And these technologies help reduce response time in emergency situations and enhance patient survival rates through AI-based triage classification. So we are seeking international cooperation in 3 areas, which the first one would be the physical AI for medical environments, enabling intelligent robotic assistance beyond surgical robots. And then the second area is the medical AI and data linkage technologies for collecting, integrating, and analyzing diverse health data. And the third would be the triage technologies for rapid patient condition assessment and prioritization in clinical and emergency settings. The second research topic KETI is proposing is the development of a smart patch for cardiovascular disease diagnosis and prediction based on on-device AI. Currently, most smart patches send ECG data to a cloud server where an AI model analyzes and it sends the result back to the user's smartphone. However, this structure depends heavily on network connectivity. And in places like in airplanes or remote areas or developing countries, real-time diagnosis isn't possible. And transferring sensitive medical data through the cloud also raises some privacy concerns. And to overcome these limitations, we aim to develop a next generation smart patch that runs on lightweight AI model directly on the device. And this on-device AI enables low power operation, stronger data security, and real-time diagnosis without cloud dependency. So what KETI would do for this proposal was the development of the AI diagnosis and prediction model on GPU servers, optimize it for NPU execution, and design the NPU circuit and embedding technology for on-device AI implementation. And meanwhile, we hope to be matched with a GITCC partner who can focus on smart patch hardware design, flexible material development, and sensor modules such as ECG and sound sensors. So together, we can aim to deliver a truly portable, secure, and intelligent healthcare solution that works anytime and anywhere. So that's all for me. I would like to express my sincere appreciation for having me today, and we hope to develop some more ideas with Johns Hopkins too. Thank you.